My name is Chris Allemand. I practice at the ART Fertility Program of Alabama. My specialty is reproductive endocrinology and infertility. I would say 90+% of our practice is trying to help couples achieve pregnancy when they've had trouble getting pregnant on their own. The average couple is probably in their mid-30s. They've been trying to get pregnant for usually greater than a year, sometimes multiple years. They very often have already tried different fertility treatments, although not always. And so we kind of come in with that history and go from there to try to apply kind of next level technology to help them get pregnant. Every couple I see is in crisis. And it's a crisis that very often they're not sharing with other people, their peers, their siblings, their coworkers. Everyone they know at people they see at Walmart, everyone's pregnant, everyone's getting pregnant, and their family's asking them, when are y'all gonna start trying? Hey, when are y'all gonna have a baby? Not knowing very often that they've been trying. In the general sense of it, you sort of take their histories, you talk to them about what they've done before, you start trying to gather some additional information, look at some factors that may not have been looked at before. And from there, it starts to make a little more sense to them when you start talking about treatment. It becomes less intimidating, it starts to make sense to them. So it's less anxiety provoking if they understand why you may be recommending something. Truth be told, the majority of patients that we take care of are going to get pregnant. Now, what I tell them is that I can't tell them when, how, exactly by what technique. Sometimes they get pregnant on their own while they're seeing me. And truthfully, it is very rewarding. I mean, there are you can't practice medicine and not have some difficult days. But I think what I do is the most rewarding thing I could imagine doing with myself, because I know that fundamentally what I'm doing is making a difference in these people's lives in ways that they may not even grasp yet. But as a parent, I can grasp it, and I understand that for what we're trying to get done, it'll be the most significant thing in their life, and it's permanent, it's forever, altering their life.